Hi, my name's Darin Carver. I'm the Assistant Clinical Director for Weber Human Services here in Ogden. And I have been asked to tell you a little bit about Weber Human Services and more so about the services that are available to anyone regardless of their ability to pay. Weber Human Services is the designated local mental health and substance abuse authority in Weber and Morgan counties. That means that we provide mental health and substance abuse treatment primarily to those who have Medicaid funding. We provide a lot of other services here as well, including aging and prevention services. We serve somewhere in the neighborhood of about 6,000 people a year. We employ about 85 counselors here at our organization and make a big difference through the service that they provide here in Weber and Morgan counties. As an organization, we've been especially committed to bringing research-based treatments to the people that we serve. In the field of mental health and substance abuse treatment, there are a lot of good ideas, but unfortunately, often those ideas get in the way of us providing science-based services. We've really focused on that. As we've done so, we've seen dramatic improvement in the outcomes that people receive as they come here. We see a significantly greater number of people who are getting better from their mental health and substance use problems as we apply these different types of research-based treatments. And in fact, Weber Human Services has been had the highest percentage of people improving or recovering of any publicly funded mental health center in the state of Utah, and we're pretty proud of that. In addition to those services, we do have some services that are available to anyone regardless of their insurance or their ability to pay. One of those is crisis services. Anybody experiencing a mental health crisis can come down to Weber Human Services or call our phone number and they will be able to speak with a counselor. We also have mobile crisis outreach teams. Those teams go out to anyone in the community who's experiencing a more serious or dramatic type of mental health or substance use crisis that might involve harm to self or someone else. And our mobile crisis teams are highly trained individuals who can both support those who are going through it and those around them who are trying to assist someone who's in a mental health crisis. Also, we have our Stabilization mobile response teams that are specifically designed to intervene with children. They provide brief crisis services to families whose children are perhaps struggling with mental health challenges. I'm going to share with you the phone numbers for each of these. If you were to call and want to speak to someone about a crisis, you could call 1-800-273-8255. If you were to search the Utah Crisis Hotline online, you would find that number. For the children's services, the number is 833-723-3326. And if you were to simply search online Utah Safe Fam, SAFEFAM, you would come across that number. And again, those are numbers you can dial 24 hours a day, 7 days a week. Crisis service is a big part of what we do for the entire community. If someone came in without insurance for mental health counseling, we might have them, we would make a referral for them to receive some brief counseling at the Family Support Center here in Utah. That would include probably 4 sessions of counseling that they would receive at no cost through the Family Counseling Center. For those who have insurance but are unable to or unsure about how to access their insurance, we can provide guidance in how to use your insurance to get the best available mental health or substance use treatment that is needed. We also, if a person does have a substance use problem, while there is a fee associated with it, it is based on a person's income. So it's a sliding fee scale. And at times, if a person doesn't have an income, then is a very, very minimal cost for substance use services. And finally, most of you are probably aware that the state of Utah is offering some support for individuals who are impacted by the COVID-19 crisis. And there's an emotional health relief hotline available to anyone in the state. That number is 833-442-2211. Again, everything that I've talked about you can find connected to our website at weberhs.net, or if you just search Weber Human Services, you'll find us. Appreciate the opportunity to share with you some information today about our organization, and please feel free to call us if you have additional questions. Thank you.